Hi, my name is Nasa. Welcome to the first episode of our geriatric care channel. Today I'll be speaking to you about the topic influenza. So influenza, or the flu, as it's most commonly known, is a highly contagious disease caused by infection from the influenza viruses. These viruses affect the upper airways and the lungs. So the flu can occur all year round, but in temperate areas such as Sydney, the influenza season typically occurs around the winter months. Flu is actually not the same as the common cold and can be a lot more serious. For some people, such as the elderly, which will be the main focus group of this channel, the flu can cause serious implications which require admission into hospital. And in very serious cases, it can actually sometimes lead to death. Flu is usually spread through infected people coughing and sneezing, which temporarily contaminates the surrounding air and surfaces with infected droplets. You can reduce the risk of infection by getting vaccinated and practicing good hand and respiratory hygiene. Symptoms usually appear 1 to 3 days after being infected with the influenza virus. The symptoms of flu include fever, dry cough, muscle and joint pain, tiredness or extreme exhaustion, headache, sore throat, and nasal congestion. Now, as I said before, the main focus of this YouTube channel will be our geriatric population. So in the elderly, fever actually may be absent, and the only signs of flu may be confusion, shortness of breath, and worsening of a chronic condition that they already have. Generally, the flu is managed by resting in bed, drinking plenty of fluids, particularly water, and taking over-the-counter medication to help relieve symptoms. Because this is caused by a virus, using antibiotics will not help at all, as antibiotics are only used for bacterial infections and can actually cause side effects such as vomiting and diarrhea. So prevention is the main aim in trying to reduce the risk of infection by the influenza virus. Getting vaccinated and practicing good hand and respiratory hygiene to protect yourself and others can do this. If you do become sick, be sure to avoid those most vulnerable, such as the elderly. Avoid visiting them in their homes or visiting nursing homes where there's known to be a large number of elderly patients. Make sure to wash your hands regularly with soap and water or use an alcohol-based hand rub. Stay at least 1 meter away from people who have flu-like symptoms. Clean frequently touched surfaces such as door handles, taps, tables, benches, and fridge doors. Vaccination against the influenza virus is the best way to reduce the risk of getting the flu. Being vaccinated gives you protection against the flu by building immunity to the virus and preventing transmission of the virus to other people. Recent changes to legislation mean that you are now able to get your flu vaccine from your local pharmacy without a prescription from the doctor. Trained pharmacists are also able to administer the vaccine in the comfort of the pharmacy. Vaccination is recommended for anyone aged 6 months and older who wishes to protect themselves from influenza and its complications. For the elderly, the flu is one of the most common vaccine-preventable causes of hospital admission. Therefore, it is highly recommended that you do get the influenza vaccine to protect both yourself and your loved ones.